Wait, hold on a second. Whew. Now that I got your attention, let me talk to you about my time that I dealt with a patient with end-stage renal disease. Whew. Cue the intro. Hi, I'm Travis Hendricks. I'm a student nurse at Concordia University, and I'm going to talk about my experience I had with the patient during this semester of clinical. I had a patient who is a 75-year-old female who came in because of COPD exacerbation. She had trouble breathing due to her non-compliance with her renal dialysis for the few weeks prior to admission. She was really congested and had retained a lot of fluid. In fact, she came in and was 20 to 25 pounds heavier than she was normal just due to the sheer amount of fluid within her. On top of those admitting diagnoses and issues, she had a history of diabetes, controlled with medication, as well as coronary artery disease, as well as hypertension, also that was controlled through medication. The patient lives with her husband at home, and her husband brought her in when she was having troubles breathing, as he knew she had a history of COPD. So when she got brought in, he stayed with her over the night and wanted to talk about the different options that they had. And she was going to dialysis at a community center every week. She had gone at the same time. And the last few weeks, the husband was just having issues with transporting her to the clinic, and that resulted in her gaining a lot of weight from the fluid and ended up actually leading to the COPD exacerbation that she had on admission. Renal disease is defined as any irreversible and progressive injury to the kidneys to the point where functioning is lost. Renal failure and disease is usually classified as different stages according to a person's glomerular filtration rate, or GFR. The patient had many different risk factors that contributed to her eventual diagnosis of renal failure and disease. First off, she is African American. She has a history of diabetes, hypertension, as well as coronary artery disease. The main contributor, in my opinion, was the hypertension. She left that untreated for quite a while, which eventually leads to vessel damage that contributes to the functioning of the kidneys. And since the kidneys vessels are so small, when they're put under that immense pressure, it could lead to rupturing and different complications that eventually leads to the irreversible loss of function of the kidneys. The patient had many different signs and symptoms that were indicative of renal disease. The main one being edema. She had around 20 to 25 pounds of fluid within her body, as I said before, and this eventually led to shortness of breath, and there's some crackles within her lungs as well. The shortness of breath brought on a little bit of anxiety within her, so she's put on incentive spirometry to try help controlling her breathing, as well as to increase the strength of her breathing. And then when we did a lab draw, her BUN was 101, which is very elevated, and her creatinine was 13.94, which is also very elevated. Her GFR was 32 as of that morning, which put her at stage 3B of renal disease. The interventions done for the patient were mostly focused on getting rid of the excess fluid that had accumulated within her body. First off, she was put on a diuretic to help promote urination and get rid of the excess fluid. She was also used compression stockings as well as SCDs to help promote circulation within her legs as she was bedbound, and this also helped push the fluid from the lower extremities up towards the core of her body. She was also then put on a potassium and phosphate protocol where they were strictly monitoring her potassium and phosphate levels to prevent them from going too high. And then the last thing she did was put back on dialysis. She was put on 3 times a week, Monday, Wednesday, Friday, and she continued to take her blood pressure meds to help limit the damage to the kidneys. Educational pieces for the patient were focused on compliance to her renal dialysis appointments. So one option for her was getting possibly some home dialysis set up to help combat their issues with transportation. Otherwise, we pertain the idea of setting up a transportation service to bring her there and from the renal dialysis place. Otherwise, main educational point was also diet, whereas we taught her that sodium, potassium, and phosphate restriction was crucial in limiting the complications that come with renal failure. And also we taught her about the idea of trying to restrict fluids just to prevent the accumulation of the fluid within her body. I found this article regarding renal disease within diabetic patients. It shows that the best ways for treating and preventing the progression of renal disease is by treating the underlying causes of the renal disease. So in her case, the treatment of her diabetes, her hypertension, as well as her coronary artery disease and her hyperlipidemia would be very beneficial in minimizing the further progression of her renal disease. Thanks again for tuning in. Until next time, I'm outie.